will PEMF help decrease the pain associated with bladder spasms in an overactive bladder? So the answer is yes. Part of the answer to that question again becomes, which magnetic system do you need? Because you have to reach deeper into the body, into the bladder. So if this is the skin on the lower end part of the abdomen and the bladder is back in here like this, then you're talking probably about 4 or 5 inches. So that means you need a higher intensity magnetic field to do adequate amounts of decreasing the spasm. So the question really becomes, what's the spasm from? Why do you have spasm? Why does somebody have bladder spasms? That's called urgent incontinence. Urgent incontinence is due to a number of different factors. Inflammation is one of them. The other factors are that the nerves become irritable. And so what happens is that a bladder that's overactive and has spasms, which can be painful, but a bladder that's overactive is contracting too fast. So when you fill the bladder with urine, then the muscles stretch. And the muscles stretch, they're called stretch receptors, so stretch signals in the bladder muscles. Those stretch receptors that pass a signal up into the spinal cord, into the sacrum, sacral plexus, that go up into the brain. So when that stretching happens, the bladder's telling the brain, I need to urinate, I need to pee. And the brain sends a signal down another nerve pathway to the bladder, say contract. Well, if the bladder is irritable and the muscles have gotten shorter and shorter and shorter over time, then that signal is sent off too soon. In other words, the bladder doesn't fill itself very much. And when it's really irritable, both the nerves in the bladder and also the muscles in the bladder are irritable, then it fires off more rapidly. And then you can have spasms. What the spasms are, basically your bladder trying to contract and you don't want to urinate because you just went to the bathroom just a few minutes ago. Well, then you hold on to it and now it's going to go into spasm and it's going to cause pain. Unfortunately, what you have to do is you have to allow the bladder to expand. And that takes time because it took time to get to this place of being too small. And the way you treat an overactive bladder is with magnetic field therapy. Very easy. It works very, very well. Children who have overactive bladders, called enuresis or nighttime bedwetting, have the same problem. They have overactive bladders. They also have a problem in their brain that the brain center that controls urination, the signal to urinate, is immature and it fires too soon, fires too readily. It doesn't take a lot of signal to fire off. So there could be a combination thing. And many children grow into adulthood and continue to have this nighttime bedwetting issue, continue to have enuresis or overactive bladder. That's the more severe forms of it. But clearly, men in their andropausal ages, in their older ages, in the 60s and 70s, particularly in the 70s, women postmenopausally have urgent incontinence. This is what we're calling urgent incontinence, overactive bladder with a spasm. So you treat the front of the bladder, the front of the abdomen over the pubic area, just above the pubic bone, sitting on top of the pubic bone, and it's putting the magnetic field into the bladder. And you also treat the sacrum, because that's where the nerve traffic for the bladder is going. So you can interrupt it at that level. And then you can treat the brain. So you can treat all 3 areas. What I would do is I would start with treatment to the front of the bladder, at least make the muscles less irritable. And again, allow the muscles gradually over time to stretch so the bladder can fill more. And then if that doesn't work, then you could add treatment to the back. And you could do both. You could treat the front first, and then you could treat the back second. Then if that doesn't work, then you have to start treating the brain. And you may have to treat all 3 areas at the same treatment session. The best treatments for this are going to be higher intensity magnetic fields. And for that, most commonly, I tend to recommend either the pulsed harmonics, the Tesla Fit Plus, or the 2 systems that I use the most. There's a little device called the SOTA, which may or may not work because it's too small. The paddle is too small. It doesn't cover a big enough area, but again, that's a place to start. And if that works for you, great. If it doesn't, then you need to go to a higher intensity system to give the magnetic field the ability to go deeper into the body to have deeper action. So therapy for overactive bladder is a process. It takes time. And the magnetic field therapy with overactive bladder can work well with the medications. So some women, particularly women who have this problem, some women are able to get off their medication after 2 to 3 months of using the magnetic field therapy, which is good because there are side effects to the medications.